Are you a hockey player with knee pain? Today we're going to demonstrate some exercises that you can do if you've recently hurt your knee playing hockey and you're getting pain around the inside or outside of the knee. This could be a problem called a meniscal tear, or also sometimes known as a cartilage tear. So inside the knee you've got these extra bits of we call horseshoe shaped cartilage, which are called your menisci, and sometimes you can be injured from a twisting injury. So if you're getting problems around either the outside or the inside of the knee, then I'm going to show you some basic exercises you can do for that. So if you've torn the cartilage on the inside portion, then that doesn't heal because the blood supply is poor. But if you have torn it on the outside, that can heal. So physio is appropriate for that problem. If it's torn on the inside, then we can do assessments and to monitor how you're doing. And if it's not improving physio, then we can refer you on to a local orthopaedic consultant. So some exercises to do if you've hurt your knee and in the initial acute phase, just to get the movement back. So the first one is just a basic knee bend, so just bending your knee up. And a lot of the time you will be restricted in your range, either into full bend, full flexion, or sometimes you struggle to get that full straightening. So the first aim of the treatment is to try and regain that full movement. So what we'll do is just encourage you to bend. Try and pull in with your hands. It's okay to feel a little bit of a tightness around the knee, but it shouldn't feel a sharp pain. So just hold at the end of range 5 seconds and then slowly down. So just repeat that and do that 10 times and then hold 5 seconds end of range. So repeat that 10 times, 2 times a day. The other one, just to start to get the muscles working, is just a static quad. So when you've had pain or swelling around the knee, the first thing it does is it inhibits switches off your quads muscles. So it's really important that we get those muscles working again. So that will help to support and stabilise around the knee. So basically we just push your knee down into the bed and squeeze this thigh muscle here. And pull your toes up towards you while you're doing that. Okay, so it's just called a static quad. So you push down, hold it for 10, and do 10 of those a couple of times a day. So you know you're doing this correctly, because when you're doing it you should see your kneecap glide up, and it's just really important that you see this muscle working. So 10 seconds, 10 a couple of times a day. And then the other one, just to start to get those quads working a little bit more, is called a straight leg raise. So what you do is you start it the same as the last exercise, static quads. You push your knee down so your leg's fully straight, toes up towards you, and you just lift. Hold it there for 5 and then slowly back down. So push down to get your leg fully straight. So it's important that your leg is fully straight and that when you lift up, you lead with your heel. So you lift up from your heel, hold it for 5 and do that 10 times, a couple of times a day. So sometimes people struggle to get that fully straight, so they end up with a lag, so that when they lift their leg, their knee bends. So it's just really important that you try and keep that leg straight, because that's how we'll strengthen the muscle better. So as I say, if you're a hockey player and getting pain around your knee, sometimes you can get clicking with it as well, and sometimes you can get locking as well, so your knee locks in one position and then you can't physically move it. Then we can assess you to determine what the problem is. If it is a cartilage problem, then if it's torn on the outer portion, physio can help. So it's about getting the full movement back and full strength back. If it's inner portion, then sometimes we need to refer you on to see an orthopaedic consultant.